In today's presentation, we're going to be talking about STIs among college students. So here is some basic information about STIs. STI stands for sexually transmitted infections, and these infections are caused by bacteria, parasites, and viruses. Now, what causes STIs? The most common way an STI can be transmitted is through unprotected sex. Another way is having multiple sexual partners. And lastly, you can catch an STI through oral sex. Why worry about STIs? Well, if they go untreated, it can lead to a worse infection. For example, HIV. HIV affects the immune system, and when left untreated, it will evolve into AIDS. And AIDS occurs when the immune system is severely damaged, which can take about 8 to 10 years. Don't be shy. Talk about STIs. It is completely normal in partners to feel nervous of opening up to each other about STIs, but it is very necessary so that both parties are healthy, immune, and stress-free of sexual infections. Where to get help? There are several sources that can offer quick, easy, and painless STI testing, such as Planned Parenthood and the Department of Health in each state in which you are located. So let's talk about some stats. In 2018, 1 out of every 5 people in the US had an STI. That's nearly 68 million people. Half of the 26 million new STIs in 2018 were among young aged 15 to 24 years old in the US. In total, treating these STIs cost around $16 billion in direct medical costs. These graphs break down the total cost of each individual STI. Almost 30% of the total medical costs for common preventable infections were incurred by young age 15 to 24 years old. The cost and prevalence of these infections could be greatly reduced if more individuals practice safety methods. There are several methods to ensure you keep yourself and others safe. Latex condoms create a barrier against STI pathogens and are an effective way to reduce the risk of STIs when used correctly and consistently. However, condoms do not provide absolute protection, so it is also best to employ other methods. According to the CDC, the most dependable ways to avoid transmission of STDs are to abstain from sexual activity or to be in a long-term mutual monogamous relationship with an unaffected partner. It is recommended to get tested for STIs every 3 to 6 months, depending on sexual activity. And lastly, here are a few things before you go. When it comes to symptoms, not every STI shows them. It is advised to get tested just to make sure. STIs can affect someone's genital area, as well as their throat. STI tests are not painful and can be administered at no cost depending on where the test is taken. And condoms are only the shield of protection from STIs, and it is recommended to use with a water-based lubricant to keep the condom from breaking. STIs are caused by virus and or bacteria, so it is best if it's treated sooner.